So this is a very disturbing story. Tamil Nadu has emerged as the state with the highest cancer burden across South India. This is a data as per ICMR and NCRP that the state recorded over 78,000 cases in 2015, which rose to over 98,000 in 24, which is nearly a 25% increase. I mean, this is disturbing, no panic. But now Tamil Nadu, this places Tamil Nadu ahead of its southern neighbors. Karnataka reported 94.832 cases, Andhra Pradesh 76,708, Kerala 61,175 and Telangana 52,334 in 2024. I mean, there are lots of cases. Of course, there can be early detection, and Tamil Nadu is doing all it can to see to it that the cancer cases come down. Let me now go across to the experts to speak more about this. I have with me Dr. Anita Ramesh, Professor Dr. Anita Ramesh, I beg your pardon, Senior Consultant, Medical Oncology, Apollo Hospitals, Chennai. Thank you so much, Doctor, for joining us on this broadcast. What is the reason? I mean, the report which I read in South First, it doesn't say because of this reason. It just says Tamil Nadu, lot of cases. Of course, one of the doctors says because we screen a lot. I don't get that. I want to ask you, is there because diabetes, Tamil Nadu is coming on top. What has gone wrong, Dr. Ramesh?
See, I think nothing has gone wrong, but it may be one of the actual figures. Because I also come from Cancer Institute. I had my basic education. They run a part of the National Cancer Registry, both hospital and population-based registry, and it's linked with the government. So they collect vigorous data from all the hospitals, nursing home, diagnostic center of the cancer cases and incidents. And the registry is very robust. And which there was a dip during the COVID time, but then there's a steady rise from 78,000 per year to 98,000 per 2024 data says. So it says robust data collection. And also Tamil Nadu is also known as the medical hub of India, where you have the we have the PMJY scheme, which brings free treatment to the cancer patient from 5 lakhs to 15 lakhs. That brings more patients to come to the hospital. They get registered, your incidents are recorded.
But you don't think also there is any, when we study a group getting cancer, I mean, I don't know if you've seen a very famous movie, Erin Brockovich. That movie was that a lot of people were getting cancer because of chemicals in their water that they were consuming. You don't think in Tamil Nadu any kind of a problem is like that? Our diets, what we are drinking, what we are, eating. There are no problems because we don't want to create panic on air at all, for Tamil Nadu, your state and my state. Go ahead, doctor.
Yeah. So I don't think so. There is a definite carcinogen identified beyond what is seen in India. Yes, tobacco-related gutka, chutka, pan, parag remains the highest incidence of cancer. Yes, with modernization movement, breast cancer is high, but the cervical cancer has come down and more in the rural area. Men, again, the commonest cancer is oral cavity and lungs, followed by the gut. So no as such alarming chemical has been identified or reported to say that Tamil Nadu is having this because of the incidence. That may not be the cause. The common reasons are high. Yes, more education, more lifestyle changes, and people are getting these lifestyle related diseases, hub of obesity, hub of diabetes, both of which is high risk for cancer. And apart from this, as I told you, we have very good screening system in place. We have district hospital, tertiary hospital. We have the primary health centers. And I was just going through the neat thing. If you see that every district in Tamil Nadu has a medical college, and a part of the medical college has also a cancer department. It may not have radiation, but yes, the cancer facilities treatment is available. So that brings in patient and you get to record these are cancer, which would have otherwise died far away without treatment. So yes, my thing is that the epidemiological factors remains the same all over India. Yes, gutka, chutka, tobacco, lifestyle related things are very high because we
but if you, doctor, tell me something. Right. Sure. So you have PMJ, you also have the state government, which helps cancer patients in Tamil Nadu. But I think that if you get numbers like this, there is some kind of action which is required, at least from doctors, from oncologists. You know, early detection is one thing, but then early detection I don't think is happening regularly. It's not the fault of the government at all. It's the fault of the people. There is no awareness that, you know, why can't we use this data to help people come and detect themselves for any kind of an anomaly, as it were, doctor. It can be changed into, if I failed in mathematics, I can get tuitions and ace it the next year, no?
Yes. Yes, yeah. So the National Control Program for Non-Communicable Disease, that the NCD, it's all over India. It is also very robust in Tamil Nadu, in all the states and districts. It's free. Screening is free for breast cancer, cervical cancer, oral cavity, and tobacco-related cancers, lung and prostate PSA. So yes, you are right. We need to raise awareness. People have to come, get checked, master health checkup yearly, so that we can pick up the cancer. You can't stop the cancer. You can prevent it, but once detected, if you are detected in an early stage, it is highly curable. So the point which you mentioned is very good. The incidence may be high, but we should take, as doctors and the government policy makers and the government, so to see that these patients come for the purview of treatment at stage, say, 0 or stage 1 or 2, and even 3 is also curable. Okay, so that's the success of the healthcare system, which will. And in the meantime, to avoid these tobacco, alcohol, and also the nuclear reactors, particularly in the atomic areas, we have the Neyveli lignite company, and then the heavy vehicle company, where you also mentioned earlier, and that holds still good, that use of heavy metals, use of aniline dyes, atomic reactors, and we have many of the shipping corporations. Yes, those all asbestos all add to carcinogens, which leads to multiple cancers of the lung, urinary bladder, and it's an industry is growing in Tamil Nadu, and that also adds to the rise of the cancers out.